On June 2nd, the Centers for Medicare and Medicaid Services released a new tool to help states plan for the eventual end of the national public health emergency. Now, the tool doesn't come with any new information on when the national public health emergency may end. Instead, it is meant to be a resource for states as they start thinking about how they might return to normal operations for processing eligibility and enrollment in state Medicaid programs. Now, specifically, the new tool highlights what the feds identify as 10 fundamental action steps that states are going to need to take as they prepare for unwinding, and that is the unwinding of the national public health emergency. More specifically, the unwinding of the continuous eligibility and Medicaid feature that has been a part of our operations for these last over 2 years. The feds say they designed this tool to be a one-stop shop tool. There are many resources that Medicaid and Medicare have been making available for states as they go through some of their unwinding planning. This tool puts them all in one place, and they break it into 10 categories. And we're going to review those quite quickly here. The first one is to create a state's unwinding operation plan. And under each of these action items in that new tool, which we link to in the description below, you can see the additional resources and links that come with each of these elements. Number 2, coordinate with government partners, including the marketplace. That's the Affordable Care Act's private health insurance marketplace. Should some individuals no longer be eligible for Medicaid, they should be evaluated for other coverage, and that could include private health insurance through the Affordable Care Act's private health insurance marketplace on healthcare.gov. Number 3, implement and strengthen automated processes. Number 4, engage system vendors to identify changes, start planning, and start doing some of that robust testing so that when the emergency ends, those systems are ready to go. Number 5, establish a renewal distribution plan. Number 6, engage community partners, and this includes health plans and the provider community, as well as advocates and some of those assisters working with low-income consumers across the United States. Number 7, obtain updated contact information, and this is something consumers can be thinking about right now. If you are enrolled in Medicaid, make sure your Medicaid office has your current mailing address. That's the best way for them to reach you, to let you know if you have any action steps should the public health emergency end at some point in the future. Number 8, launch effective communication strategies, including consumer outreach and revised notices. And number 9, assess workforce capacity and conduct training. There are going to be a lot of rules that return to regular operations as well, and everybody should be on the same page of what those rules and processes look like. And finally, number 10, implement a robust monitoring strategy, including timely reporting to the Centers for Medicare and Medicaid Services, and that's action steps particularly identified for state governments. You can read these action steps in more detail. We link to them in the description below.